Hey guys, it's Dr. David Abbasi. In today's video, I want to talk about the medical course of events that led to the passing of Scott Hall. The story kind of started back in March where it sounded like he had a fall and fractured his hip, underwent a total hip replacement surgery, and then after that hip replacement surgery, he had very serious complications. He threw multiple clots and then ended up having several heart attacks and unfortunately was placed on life support and was never able to be weaned off the life support and passed away. So I want to just break that down step by step. So starting with this unfortunate incident, he had a fall which resulted in a hip fracture. Usually that does require an operation to stabilize the hip because the hip doesn't have a great blood supply, but the fact that he needed a total hip replacement tells us it was a very severe hip fracture which was displaced. And so when the bone separates, it loses that blood supply, so you're basically forced to do a hip replacement if you want any chance of walking again. Now, unfortunately, it sounds after that hip replacement operation, what was written was that he threw these blood clots. And so what they're likely referring to are deep vein thrombosis, or they're called DVTs. And those are blood clots that can form in the legs after medical procedures, or a person can develop blood clots in their legs without surgery as a result of injuries, or sometimes we don't know why they occur. But basically these deep vein thromboses, or these DVTs, as long as they stay in the legs, they're not very dangerous, and we can treat them with blood thinners, medical treatments. But if they dislodge from the legs and go up to the lungs, then we call them pulmonary embolisms, or PEs, and those are very, very dangerous. It can cause death. And how that happens is basically this blood clot goes up to your lung. The lung now is basically clogged up and unable to pump oxygenated blood to your heart. So your heart receives this oxygenated blood from the blood flow from the lungs. If the lung is clogged up, it is unable to do that. Now the heart is not getting oxygenation in blood, and it can have heart attacks. And we know that Scott Hall also had, the report said, multiple heart attacks. So that could have been the route to develop these heart attacks. Now, a heart attack is basically when the heart is not getting enough oxygen, and now the heart is unable to do its job, which is to pump oxygenated blood to the rest of the body, including the limbs and including the brain. And so when he was placed on this life support, unfortunately was never able to get weaned off it, because it sounds like probably he underwent brain death because of the lack of the oxygenation likely to his brain and other vital organs. So really, really sad story. And when they took the life support off, unfortunately, he passed away shortly after that. So all the best to Scott Hall's family. It just kind of reminds us how precious life is. And really the risk of orthopedic injuries is very, very real. You know, hip fractures, hip replacement surgeries, those are operations, or those are injuries that can have high medical complication rates, including, blood loss, infection, blood clots, and even death. And so normally after these operations, we do routinely give patients blood thinners, sometimes up to 28 days. It will help decrease the risk of blood clots, but of course nothing is 100%. And unfortunately, it sounds like Scott Hall just got the worst of it on this one and was never able to recover. So again, all the best to Scott Hall's family and the WWE family as well. And we'll see you guys here on the next one.